Hello, we are Group 17 and our program is called Hope for Home, and we will enhance the health status of the homeless population in downtown San Diego and Los Angeles. We will work on reducing homelessness by providing a variety of services, focusing primarily on mental health and substance abuse to improve their quality of life. Our 2 clinics will provide 4 workshops. In these workshops, there will include basic physical health care services, counseling sessions, support groups for addiction and mental health, job training, and placement services. We will make the public aware of our available clinics by handing out informative flyers in the cities of Los Angeles and San Diego. The goals of our program are to improve the mental health within our target homeless population, to reduce the incidence of alcoholism and substance abuse, to increase homelessness viability to enter the workforce, reduce the amount of emergency room visits, and for the success of our overall program by having our participants complete each of the 4 workshops.
Our 3 main objectives are: by the year 2020, 40% of the target homeless populations will be using services offered at each clinic. By the year 2020, homeless individuals in clinics will show 30% less substance abuse and dependence compared to those in other cities. At the completion of each workshop, homeless participants will report 15% less barriers in receiving help physically and mentally in efforts to improving overall well-being. Our intervention program uses the health belief model to promote behavior change. Through this model, we will increase perceived awareness of their current health status and poor living conditions and create positive expectations that our clinics and services will be effectively addressing their health issues. It will also cause the belief that they are capable of change. Perceived barriers we plan on encountering are that homeless populations often do not believe they have access to healthcare services, and their mental health may get in the way of wanting something better or believing that they are capable of achieving positive health outcomes. Outcomes for our intervention programs at 2 of our clinics will be measured subjectively through observation and surveys, which will be recorded before any workshops have taken place, after the first, second, and third workshop, and then after the entire completion of the program.
All 80 patients will complete our 4 workshops at Los Angeles and San Diego for a total of 160 in the 2 cities. We expect the results at the Los Angeles clinic to differ from those at the San Diego clinic, since the 80 patients there will be required to remain at our clinic until the completion of our 4-month-long program, with each workshop being 1 month long. The workshops at this location will be more aggressive as well. Our San Diego clinic will be outpatient, as homeless individuals participating will not need to stay for the duration and can come and go as they please. With Los Angeles being a more intense treatment program, we expect that we will have better results than with our comparison group, which is the San Diego outpatient clinic. Our experimental design is quasi-experimental in that we have 1 experimental group of 80 inpatient participants, and then we have a comparison group of 80 outpatient participants in San Diego. Our timeline shows when we will record results from observation and survey. Each workshop is a month long, and we will evaluate the condition of our participants in both groups at the end of each month. The purpose is to determine how many participants complete each workshop in order to move on to the next one. We will also conduct our observation and surveys at these times to further assess their progress. After a course of 4 months, this progression will tell us whether an inpatient, more rigorous treatment program or outpatient care is best for our target population. Our main outcome is whether or not the homeless populations in San Diego and Los Angeles accessed our clinic and completed each stage of our program. With a survey, we will determine how many of the offered programs participants actually completed. The answer to this question will be a ratio response.